Allina Volunteer of the Year, or Volunteers of the Year. We submitted their contributions to the Minnesota State Hospice and Palliative Care Conference that annually recognizes one volunteer a year that makes significant contributions to hospice care and hospice patients throughout the state. Well, we were unique and we submitted them as a couple. They were among 8 volunteers that were given special recognition for their commitment to hospice care at the conference that was held in Bloomington on April 8th. Their 19 years of volunteering have made a significant difference to hospice care in Owatonna and the surrounding 5 counties that we serve. I am going to just read a little bit about their nomination because I think their commitment deserves special recognition. Bill and Betty's interest and involvement with hospice care began in 1994 when Betty's sister came to live with them following the diagnosis of a terminal disease. Betty's sister received hospice care while they were living in their home until her death. Following her death, the couple desired to continue their commitment to quality hospice care by attending hospice volunteer training in 1995. Initially, both Bill and Betty served as patient visitors, and they provided respite care and support to many community hospice patients and their caregivers. They served patients in private homes and in various care facilities throughout the Owatonna area through several years. They both fondly remember patients and their caregivers and the relationships that were developed. Gradually, their commitment to hospice care grew to include much more than patient visits. They were instrumental in forming a committee of community members who wished to see a residential hospice house built for Owatonna and surrounding communities. Over a period of time, they visited several other hospice houses in the state of Minnesota to gather information in preparation of building our own hospice facility. Throughout the next 3 to 4 years, the committee worked through many challenges to decide upon a location and then to acquire property for what would eventually become the Homestead Hospice House. The next phase involved extensive fundraising. Many of you may remember those years. The couple remained actively involved through the completion of the 8-bed hospice house in 2004. Today, the Homestead Hospice House staff has cared for over 590 patients in this 8-bed facility because of Bill and Betty, along with several other community members, had a vision for a home-like environment to help care for hospice patients. For many years, Bill and Betty have helped promote hospice care by organizing and staffing the hospice booth at the Steele County Fair each August. They have assisted with the annual Star of Hope event each December, which is a fundraiser for our patient care fund, and also an opportunity for hospice patients' loved ones to gather in remembrance during the holiday season. They have also worked at and supported a variety of fundraising efforts to provide financial stability for our patient care fund and also for equipment and maintenance needs at the Homestead House. Bill has served as chairman of the advisory board for 6 years, ending in 2012. He has also served on the Homestead House Inc. board, which owns the building and the property that acts as Allina Health's hospice landlord. Today, Bill remains active in the Community Relations Committee, which continues to promote hospice care in our community, and he helps organize our annual beer tasting event, which raises dollars for the Patient Care Fund. He also continues to serve as a driver on most Thursdays throughout the year, and he picks up supplies at the hospital, which are ordered by the Homestead House staff. He makes time to visit with and support the hospice staff and the patients. For over 8 years, Betty has been the communication link and organizer of our 40-plus daily meal drivers who pick up meals at the Owatonna Hospital and deliver them to the Homestead House every day. She contacts volunteers and creates a monthly calendar of volunteer drivers. She has also served on the Community Relations Committee for 7+ years. On this board, she is involved in community education and outreach in addition to fundraising efforts. For 19 years, this couple has generously donated their time and talents to support patients and their caregivers and to strengthen hospice care in southern Minnesota. Although we do not have volunteer hours recorded prior to 2009, it is estimated that they have given well over 1,300 volunteer hours to our patients, their caregivers, and to promoting hospice care. Their passion, persistence, and their willingness to get the work done has helped to create the wonderful, growing, and well-respected hospice program that we have today. This couple's energy and hard work has made a significant difference in the lives of hospice patients and their loved ones in our area. We recognize them and we honor them for the meaningful contributions they have made. Please stand forward. We just have a card of thanks for them.
Thank you.
I realize there are several others of you in this room that have also contributed so much over the years. I'd like to ask anyone that was involved in the original dream and the fundraising of building the Homestead House, would you please stand? We thank you. I just think it's amazing that really over 600 patients have been served in that house. That's a pretty neat thing. And I know Laura already talked about the We Honor Veterans team of volunteers that helped us achieve that recognition, and I'd like those 3 volunteers that are here today to please stand. So Lynn, Jade, Sue. Thank you. And many of you in this room have served our patients with one-on-one patient visits, and that's just really special work, and it's a much needed work. So we thank all of you that have taken one-on-one patient visits and have made a commitment to visit those patients no matter where they are, whether they're at the Homestead House, in community facilities, or in private homes. Thank you for giving your time of that way to directly serve the patients and their families. Also, our breakfast cooks, my gosh, once a week our breakfast cooks come and make breakfast at the house, and they're just a real vital part of our hospice team, and they provide a pretty neat service to our patients. All our bakers